Support Community South Bay. Today we have Dr. Deborah Wong presenting on head and neck cancers. I'm Nancy Lomibao. I'm the Chief Clinical Officer and Program Director here at CSC South Bay. And if this is your first time joining us, we just want to let you know a little bit about ourselves. We are a premier nonprofit organization providing emotional support, education, and hope for people affected by cancer and their loved ones. We serve the South Bay, Long Beach, and Orange County, and everything is offered at no cost. Our programs include support groups, individual counseling, networking groups, healthy lifestyle classes, social activities, and educational programs. If you want to hear more about our services or join our community, please visit our website at cscsouthbay.org. Now, without further ado, I'd like to introduce to you our workshop speaker. Dr. Wong is an associate clinical professor of medicine at UCLA and the UCLA Director of Clinical Trials for head and neck cancers. She completed both her MD and PhD degrees at UC Irvine. As a medical oncologist, Dr. Wong cares for patients in both UCLA Westwood and UCLA Torrance, and is on the medical staff of Torrance Memorial Medical Center, Providence Little Company of Mary Hospital in Torrance, in addition to UCLA Medical Center. She's interested in finding newer and better treatments for cancer patients through clinical research and clinical trials. So if you have questions during this workshop, she invites you to unmute yourself or put them in the chat box as she goes along. Dr. Wong has invited us to have a dialogue today. So please help me welcome Dr. Deborah Wong. Thank you for being here.
Thank you, Nancy, for the introduction. Thank you, everyone, for participating and joining me this evening. Can you all hear me? Can you give me a shout out or something? Okay, perfect. Thank you. And then can you see my screen, the title slide here? I'm not the most Zoom savvy, so thank you so much, Peter, for that confirmation. All right, so as Nancy had mentioned, I really am discussing with Rebecca and Nancy, organizers, what might be of interest to the group. We thought about talking about cancers of the head and neck because that's my specialty, but touching upon not just treatments, but maybe some strategies for successful survivorship. And I'm hoping that, as Nancy mentioned, that if there's interest, that this would be a dialogue. So as informal as you all feel comfortable with, I certainly have a number of prepared formal slides that we can run through as well. But if you have a question or you would like to kind of chime in with a comment or your own experience, please feel free to unmute yourself and speak up. Otherwise, I can get started on my presentation. As Nancy mentioned, I am a medical oncologist, so I treat cancers primarily with medication treatments. For head and neck cancer, that includes chemotherapy, targeted therapies, and now immunotherapies. And being head and neck cancer treatments, much like many other cancers, really successful treatment requires input from a multidisciplinary team. So I work very closely with our head and neck surgeons, our radiation oncologists, as well as our clinical nutrition physicians and dietitians, our speech and swallow therapists, and even our dental colleagues. And so, as I will touch upon, really to be successful in regards to navigating cancer treatments and survivorship for head and neck cancer, really it requires input from a multidisciplinary team. And so for those of you who have personal experience, again, I would welcome your input and just the sharing of your experience as well. But just in the way of background, since I am a medical oncologist, I thought I would first set the stage by talking about some of the treatments that are involved in typical treatment for head and neck cancer. And so let's see. Let's see if I can figure out. Let's see. Okay, there we go. So when we talk about head and neck cancer, the vast majority, this is kind of the anatomic region in which we are focused on. So they're cancers that arise from anywhere from the nose all the way down to the throat or to the upper, to the clavicle area, the collarbone area. Most of these are what we call squamous cell carcinomas, and most of those arise from the lip and oral cavity, the throat, the oral pharynx, the hypopharynx, or the larynx, the voice box. In addition, a smaller proportion of squamous cell cancers of the head and neck can start in the nasopharynx or the sinuses themselves. A smaller proportion of head and neck cancers are what we call adenocarcinomas, and those typically arise from the thyroid. So thyroid cancer is sometimes classified as a head and neck cancer, or salivary glands. And so, but most of the time when we're talking about treatment for head and neck cancer, we're really referring to the squamous cell carcinomas that arise from the first 5 sites: lip and oral cavity, pharynx, oral pharynx, hypopharynx, and larynx. And so if we look at, these are some statistics that are notable. This is from the American Cancer Society. They publish this every year, detailing the incidences and deaths from cancer in the US. And as you can see, the top panel here, these are data for 2022. The top panel shows for males versus females, the most common in cancer diagnoses. So the new cases, most commonly in men, are prostate cancer, followed by lung cancer and colon cancer. If you look, oral cavity and pharynx cancer is number 7 or 8 here on the list for men. In women, most common cancer is breast cancer, followed by lung cancer, colon cancer, and actually head and neck cancer doesn't reach the top 10 in terms of cancer, new cancers diagnoses. In terms of cancer deaths, we have, those are listed here. Fortunately, because of treatments that are quite effective, although they can come with side effects, head and neck cancer can oftentimes be cured. In terms of questions
we have a couple in the chat, Dr. Wong. So the first one is, any suggestion on how to get rid of dysplasia on my vocal cords? For 16 years, my doctors say that's why my cancer keeps coming back.
Yeah, dysplasia, or sometimes called leukoplakia, is a really relatively uncommon, but it can be a significant issue for many patients. These are areas, for those that just to get everyone on the same page, these are areas of abnormalities, abnormal cells in the lining of the mouth or on the vocal cords, for example. And these abnormalities can sometimes, over time, become more abnormal and become overt cancer. And so in patients who have this condition, it's an ongoing monitoring program to kind of try to address it, the dysplasia, sometimes with laser ablation or surgery, to see if we can prevent, and then close monitoring if there's any changes that look concerning for cancer. Unfortunately, currently there's no effective treatments beyond kind of monitoring and laser ablation to physically remove the areas of abnormal cells or dysplasia. But we are working on research to try to see if newer and better ways to address dysplasia can be identified. So one clinical trial that we have ongoing at UCLA is to look to see if an immunotherapy treatment called Keytruda, which is used for frank head and neck cancer, can be a successful treatment for precancer or dysplasia. And so that's one experimental option, but beyond kind of close monitoring and treatment with your surgeon right now, that unfortunately there's not there's not a lot of other successful preventative strategies.
Thank you, Dr. Wong. We have one more question. Would be interested in your perspective on proton versus photon therapy for oropharynx cancer in terms of both effectiveness and side effects.
Yeah, so that's a really great question, usually I would have to defer that question to the expertise of my radiation oncology colleagues. Typically for head and neck cancer, the most common type of radiation that we use is actually external beam radiation, but detailed discussions on when we would use protons versus other types of radiation. Really, I have my colleagues in the radiation oncology department discuss that with patients.
One more question, Dr. Wong. This participant is post-throat cancer. Throat pain is terrible after 18 months. Will it improve?
Yeah, that's a great question. And oftentimes, as I mentioned, although cancer, we can effectively treat cancers, particularly head and neck cancer, many times patients who see me in clinic after they've had their cancer treated have ongoing side effects. And sometimes it's side effects from surgery, sometimes it's side effects from radiation or chemotherapy or the combination. These include swallowing, pain, a dry mouth, and things like that. It can continue to improve even this far out after treatment of the cancer. Although if it's this long from your cancer treatment, usually I incorporate or referrals to our pain management colleagues and other folks, including our speech and swallow therapists and things like that, to see if there's a component of almost physical therapy for your swallowing muscles that might help eventually strengthen those muscles to alleviate the pain.
Thank you, Dr. Wong. That's it on questions for now.
Okay, great. Thank you. All right. Let's see if I can. All right, so in terms of how we treat head and neck cancer, really it depends on where the cancer starts and where it has spread to. So this is a diagram of the head and neck area showing that if the cancer were to spread, the most common location for spread would be to the lymph nodes under the chin or in the neck. And so these are the different lymph node levels shown in this diagram. But typically, if it's only in the head and neck area, in the mouth or in the throat, sometimes treatments can achieve very good cure rates with either surgery or radiation alone. And whether or not we use surgery or radiation really depends on the patient's preference, where the tumor is located, and what a surgery would mean in terms of functional outcome. As well as, and so even in the very early stages, oftentimes we have a big team of people to help provide their input and consultative expertise to help patients, to tailor the patient's treatment plan specific to their goals of care, and keep being mindful about the best oncologic outcome, the best chance for cure. Now, if there's spread to the lymph nodes from within the head and neck area, usually that's termed locally advanced disease or local regional disease. And if there is lymph node spread, many times the chance of cure, it's still curable, but the chance of cure, because there has been spread, goes down compared to if there were no lymph node spread. And so that's where we start to employ more than one mode of treatment. So surgery followed by radiation, surgery followed by chemotherapy and radiation, or proceeding directly to chemotherapy and radiation. And again, this is where we involve the expertise of all of our consultants, including our radiation doctors, our surgeons, our speech and language pathologists, and swallow therapists to help us tailor a treatment plan that makes the most sense for the patient. Sometimes we will omit surgery if the surgery itself would result in significant effects on patients' ability to kind of eat and drink normally. For example, so-called being able to preserve normal function as much as possible. In that case, if we proceed directly to chemotherapy and radiation, typically we would reserve surgery if the cancer unfortunately were to persist after completing chemo and radiation, or if there's recurrence. And so, as I mentioned, so in the setting where the cancer may be more advanced, then we start to employ different treatment modalities, including chemotherapy. And that's kind of where we start to talk about kind of side effects going through treatment, as well as potentially afterwards in terms of moving into the survivorship realm. So as I mentioned, I primarily treat cancers with medication treatments. And so I thought I would just highlight some of the common treatments that I would use and manage in treating head and neck cancer. Fortunately, most of the time when patients are presenting to our clinics to be seen for a new diagnosis of head and neck cancer, we oftentimes are talking about a situation in which the goal would be to get rid of the cancer altogether. And even if it means employing surgery, radiation, and even chemotherapy. So the side effects that impact patients' function during treatment as well as long-term after treatment really are dictated by how these drugs work, and because those also kind of tell you about how they affect the normal body function and therefore side effects. And so one of the common drugs that we use is chemotherapy, cytotoxic chemotherapy. One common one is called cisplatin. This is a diagram of the DNA of a cell, of a normal cell or of a cancer cell. But chemotherapy agents like cisplatin are commonly used for treatment of head and neck cancers. And what they do is, as indicated by this yellow line, that's they kind of stop the DNA from being able to separate, and as the cell is trying to divide. And so chemotherapy agents like cisplatin prevent cell division, cancer cell division, by intercalating it between the double strands of the DNA. Now, chemotherapy, although we try as much as possible to target only the cancer cells, typically are not good enough just to target the cancer cells, which is why we have issues with side effects. So with cisplatin chemotherapy, the side effects can include a lot of nausea and vomiting. Potentially it can affect the kidneys. Potentially it can cause nerve damage, so numbness and tingling in the fingers and toes. It can cause ringing in the ears and even hearing loss. And so these are all things that we are mindful of as we're going through treatment, and we ask our patients about every time. Some of these side effects primarily occur during the course of treatment and then kind of resolve when treatment is finished, although some side effects can be long lasting. And so these are things that we discuss with our patients and try to mitigate for. So for example, for the nausea and vomiting, we will routinely give medications to help prevent nausea. And then also patients have at home medications to have to address side effects. So beyond chemotherapy with drugs like cisplatin, another class of drugs that we often use to treat cancer called targeted therapies. Cetuximab is a targeted therapy that we use a lot for head and neck cancer, especially when combined with radiation, especially for patients who, for some reason, aren't able to tolerate or are not good candidates for cisplatin chemotherapy. As opposed to chemotherapy, which really tends to work by blocking the cell's ability to divide and replicate, what targeted therapies do is they tend to block a protein that is overexpressed in cancer cells. So for cetuximab, this is an antibody treatment that blocks a protein called EGFR that is highly expressed for head and neck cancer. And so because it's not chemotherapy, side effects can be quite different than with cisplatin. We don't see as much nausea and vomiting. We see more of a rash. We see some skin findings, sometimes diarrhea, and sometimes electrolyte, low potassium or low magnesium. And so knowing kind of the exact treatment plan that you're about to undergo as a patient, be it surgery or different types of medication treatment or different types of radiation, can really help you prepare to navigate kind of and anticipate what some of the side effects that you'll have to do, be mindful of as we go along. And it also helps your care team as well. And so as you can see, side effects of the cetuximab are quite different than cisplatin. In addition, so we have side effects from the drugs that we give for head and neck cancer, but also side effects of radiation can be pretty significant as well. So radiation along with chemotherapy can cause dry mouth, a change in the way things taste, skin rash or skin breakdown, almost like a bad sunburn, mouth sores, pain, of course, pain with swallowing, and weight loss because of it being difficult to eat and drink. And so these are things that we are also mindful of, and we would have to kind of prepare for as we navigate treatment for patients who have head and neck cancer. And beyond the chemotherapy, targeted therapy, potential side effects of radiation, more and more these days we have a new class of drugs used to treat cancer, head and neck cancer, called immunotherapies. And these are a third class of drugs that are used for cancer treatment and very important for managing patients with head and neck cancer. And being, so as opposed to chemotherapy, which works by blocking the cell's ability to divide and replicate their DNA, or targeted therapy, which works by blocking proteins that are overactive in cancer cells. What immunotherapy treatment is this is a mode of treatment in which we're trying to use drugs to turn on the immune system so that the immune system recognizes the cancer as being foreign, and you're then harnessing your own immune system to fight the cancer. So there are two, so this is a very simplified diagram of some of the immune cells that are involved with immunotherapy. The target for immunotherapy, the most commonly used immunotherapies, you may have heard of Keytruda or Opdivo, pembrolizumab or nivolumab, really target this PD-1, PD-L1 pathway here, essentially trying to block the PD-1, PD-L1, and therefore turn on the immune system so that your immune system can recognize and attack the cancer. And so for head and neck cancers, there are two PD-1 immunotherapies that are FDA approved for treatment. I mentioned them already, nivolumab, which is called Opdivo, and pembrolizumab, which is called Keytruda. And these drugs really have allowed advances in patients and better outcomes for patients with head and neck cancer and other cancers as well. Now, Keytruda can be used either alone or in combination with chemotherapy in patients with cancer that has come back after surgery, chemotherapy, and radiation. And so being a third class of drugs used to treat head and neck cancer, again, with a distinct mechanism of action from the targeted therapies and the chemotherapies, these immunotherapies have a unique side effect profile. As I mentioned, they work by trying to turn on the immune system. And so in essence, the side effects we worry about come about because of overactivation of the immune system. Now, fortunately, most of the time, these side effects are very mild and manageable, most commonly being some fatigue, decreased appetite, rash, thyroid, underactive or overactive thyroid, or diarrhea. And however, potentially serious side effects can occur that come about because of inflammation of the organs, any organ. So as listed here. And so understanding kind of how these drugs work and kind of being able to anticipate potential side effects is really important in helping to successfully prevent and even treat side effects for our patients. And so because we know these drugs work by turning on the immune system, managing side effects oftentimes involves, of course, us holding the treatment, but also potentially treating with immune suppression, such as with steroids. And so the managing side effects of immunotherapies is quite different than how we would manage side effects of targeted therapies or chemotherapy. Just to highlight, in terms of comparing traditional chemotherapy to immune therapy, and the side effects that are seen in the clinical trial that led to the approval of immunotherapy compared to chemotherapy for patients with head and neck cancer. This is a diagram from that publication that outlines in green how the incidence of various side effects with immunotherapy Keytruda compared to extreme, which is a combination of chemotherapy and targeted therapy. So as you can see from this graph, the most common side effect with immunotherapy was fatigue and rash and some decreased appetite. But as you can see, the incidence and the severity of the side effects were much less than what we see with chemotherapy and targeted therapy. So all in all, with these three classes of treatments for head and neck cancer, in general, the immunotherapies have less severe and more mild side effects, although, again, because of the way these drugs work, they have a unique side effect profile that we have to kind of be mindful of and be on the lookout for the potential side effects that are unique to the different types of treatments that we use for head and neck cancer. And so just in conclusion for this part of the talk, head and neck cancers are a pretty important cause of cancer morbidity and mortality. We have lots of good treatments, including surgery, radiation, and as I detailed, chemotherapy, targeted therapy, and immunotherapy. But as I showed you, for particularly emphasizing the medication treatments, they can have both short-term and long-term side effects that affect patients, your quality of life. But certainly, they're all important components of treatment. And so with that, that's kind of a background as to kind of the landscape for current treatment for a lot of the head and neck cancers that we treat. I wanted to switch gears and focus more on kind of how to manage and get through treatment successfully. I'm going to switch presentations here, and let's see if I can figure this out. Okay, can you see these slides here? It's the Frankly Speaking About Cancer. So these slides are really put together by Cancer Support Community as a series entitled Frankly Speaking About Cancer for patients to try to help help patients and support navigate treatments as successfully as possible. And so these slides were put together by the Cancer Support Community team in conjunction and reviewed by Dr. Moore a couple of years ago. I think the information here is definitely quite pertinent to anyone who's going through head and neck cancer treatment, be it surgery, radiation, or chemotherapy, or some combination of all of that. Okay. As I mentioned, it was developed by a CSC, and we reviewed it and tailored it to this particular workshop. This specific presentation was supported in part by grants by Bristol Myers Squibb. And as in the interest of disclosure, through UCLA, through the clinical research that we do at UCLA, I have received research grants that are paid directly to UCLA from Bristol Myers. And so one important component of getting through or living with head and neck cancer is surviving after treatment is really being mindful about optimizing your nutrition. And so a lot of the presentation focuses on nutrition and how to do that well. And for those of you who have gone through cancer treatment, I would welcome your insights as well into how to best maintain nutrition as having gone through treatment or going through treatment. And so we'll discuss benefits of nutrition for patients who are living with head and neck cancer, the nutritional impact of different treatments, the importance of that multidisciplinary team that can include a dietitian and the healthcare team, managing nutrition-related side effects, how to deal with long-term side effects of head and neck cancer, and then helpful tips. Actually, frankly speaking, About Cancer has a booklet that is available as a resource that has recipes and a lot of this information as well. Certainly cancer diagnosis, particularly in the head and neck area, can definitely affect your nutritional status and how you're able to take in your nutrition. So certainly if you might imagine, if you have something going on in your throat, you may start to have pain with swallowing or difficulty swallowing various types of food. And so many times these symptoms can start even before treatment and may be the first sign of something going on in the head and neck area that needs to be evaluated. And so about 25% of all of our head and neck cancer patients are actually malnourished, underweight before treatment begins. And that's an effect of both where the cancer is located and its effects on swallowing function, but also an effect of the cancer itself almost being a parasite to suck the nutrients away from the patient. And treatment itself can worsen this. Radiation treatment can increase the risk of malnourishment for head and neck cancer patients by a significant degree, 85% as indicated on the slide. And so nutrition is clearly, as I mentioned, from the initial diagnosis, pain with swallowing, mouth sores, and resulting in weight loss. And so good nutrition really has an important role before, during, and after treatment. It really can impact how patients survive even after they're done with treatment. And so what are the benefits of being as optimally nourished as possible during treatment? So certainly if you have adequate calories and nutrition, this allows your body to have the strength it needs to get through treatment on time. We know that timely treatment and minimizing the need to take breaks from treatment is really important, especially when we're talking about radiation, where staying on track really is important. In addition, being healthy and strong going into treatment usually means you're able to withstand treatment throughout, but also your recovery is faster. Having good nutrition and having good physical function beforehand also can prevent hospitalizations, or if you need to be hospitalized, because those are additional stresses on your body, having good nutrition to begin with can shorten the duration or the severity of the hospitalizations. Good nutrition can prevent weight loss and malnutrition, and it also can help prevent and even manage treatment-related side effects. The benefits of maintaining good nutrition after finishing head and neck cancer treatment. So a lot of times, if you've ever been through a course of radiation or even surgery and recovered from that, or even chemotherapy, you know that during the course of treatment, you tend to lose a lot of weight. And so if we can shore up that weight loss before treatment and during treatment to minimize that, then that definitely helps in the post-treatment recovery phase. It can help with recovery from the lingering side effects from treatment. And then as much as we're able to maintain good nutrition and swallowing function, we are able to recover from treatment and get on to developing healthy diet and lifestyle after treatment. which can then prevent long-term other complications and other medical issues like heart disease, diabetes, other cancer diagnoses. Good nutrition is also really important in terms of, particularly for head and neck cancer, by really trying to help maintain dental health. Patients who've undergone head and neck cancer treatment are a particular risk from dental problems because of radiation to the head and neck area, effects on saliva, which is really important in helping to prevent decay. And so good nutrition, which tends to help stimulate saliva, for example, can also be an important factor in preventing tooth decay and long-term healthy lifestyle after cancer treatment's done. So as I already mentioned, side effects of chemotherapy can include a lot of the things that are listed here for side effects of surgery. So certainly chemotherapy and surgery can cause decreased appetite, difficulty chewing, pain, tongue numbness, changes in taste, and stiff jaw muscles. And so certainly just the changes that patients undergo from surgery and recover from surgery can definitely impact the patient's ability to take in nutrition. And so in some cases, if the side effects are so much that the patient has a hard time taking in adequate nutrition, then sometimes we will place a feeding tube to make sure that we can try to optimize nutrition during treatment. And so some of the nutritional impacts of chemotherapy and radiation are listed here. I mentioned many of these as in my initial few slides: decreased appetite, weight loss, dry mouth, nausea, vomiting, diarrhea, constipation, mouth sores, change in taste or loss of taste, difficulty swallowing, and fatigue. And so these are all the challenges that patients who are going through head and neck cancer treatment face, and this is in the setting where we know that optimal nutrition is really important for successful cancer treatment. And so, as I mentioned, in some cases, we will consider a feeding tube to try to optimize nutrition to help patients get through a treatment. It is an individual decision that's made between patients and the all the different care components of your care team. So at UCLA, unless it's absolutely necessary, we try to avoid placing a feeding tube in the beginning, but we closely monitor patients' weights during treatment. And if patients lose excessive amounts of weight, then we discuss altogether the pros and cons of placing a feeding tube. We know that we prefer not to from the beginning because we know that long-term swallowing function and recovery after treatment for head and neck cancer really is fast. The recovery is better if patients keep swallowing during the course of treatment. And when you have a feeding tube that's placed from the get-go, then we know from various research that's been done that patients who have a feeding tube are maybe less likely to recover their swallowing function long-term. And so really, unless we need to from the beginning, we try to avoid putting in a feeding tube, but we will certainly do so in order to make sure that the patients are able to get through treatment as best and as well as possible. But again, it's an individual decision. It's tailored to the patient and tailored to the patient's specific situation. And so if now many of our patients, who go through treatment and end up with a feeding tube, really it's a hard thing to accept. But in the words of one head and neck cancer survivor, if you're a head and neck cancer patient going through radiation, it's going to be painful. It's going to be hard to swallow. And if you need a feeding tube, don't avoid getting one, because that can help you take the pressure off to get nutrition in. And we know how important nutrition is in getting through treatment successfully. And so I would say that this sentiment is really something that I try to emphasize with all of my patients, not just in regards to feeding tube, but also in regards to managing side effects. A lot of us go into cancer treatment, wanting to avoid taking medications to manage things and trying to do it naturally without medications. And so really taking medications and accepting of the different interventions that we have sometimes is really, really important to ensure a successful treatment. And so what Christy's saying, to kind of accept kind of all the support to get through treatment as successfully as possible is really, really important. Before patients at UCLA start their cancer treatment, be it surgery, radiation, or a combination of chemotherapy and radiation, we always have them meet with a dietitian because of the importance of good nutrition going into it. And so having a dietitian involved in your care is important to help with side effects and symptom management, to help us know what our calorie goals are for patients, because when you're a patient going through cancer treatment, your body is expending extra energy, needs extra energy to not just stay nourished, but also to manage the side effects of treatments. Oncology dietitians can be helpful in identifying not just calories, but what special diets. They have a lot of experience with alternative consistencies of foods that will help patients with head and neck cancer and other cancers be able to get the nourishment that they need. They can help with dietary supplements, as well as formulate special diets as needed for patients who have specific allergies or food intolerances. And so a dietitian is definitely a part of the head and neck cancer program's team of experts. And so, as I mentioned from the get-go, one of the keys to successfully getting through treatment and surviving is to keep your team apprised of what's going on with you, whether it's before treatment starts, so that we can address pain, trouble swallowing. We can get you plugged in with our speech pathologist, or things to kind of optimize everything going into treatment. But during the course of treatment, keeping us apprised as to what side effects you're experiencing, so that we can help, so that your team can help adjust medications to make them more manageable, to make treatment more manageable for you. And so during the course of head and neck cancer treatment, oftentimes patients will see my team or a radiation oncology doctor's team at least once a week. And typically, if you're a patient receiving chemotherapy with me, you would see my nurse practitioner or me at least once a week. You would see my nurses multiple times a week. We would check blood work and really be there as a resource, as a check-in to talk about side effects and how we can kind of tweak medications, tweak the regimen to tailor it so that you can get through treatment as successfully as possible. We're also there to troubleshoot things like feeding tube problems, difficulty swallowing, to introduce additional medications or adjust medications for side effects like pain, nausea, or diarrhea. And so to get the most and successfully navigate treatment and post-treatment kind of survivorship, keeping dialed in with your medical team is really, really important. We do that in the form of regular follow-ups during treatment and after treatment. And so this includes, if you have a feeding tube, checking in about any side effects you're having from the tube feeds. Some patients are more sensitive to some tube feed formulas than others. Same with as you're going through treatment without it and you're eating and drinking, the types of foods or the consistencies of foods that you're able to take in may change as you go through treatment. Also, a big issue is kind of the financial burdens of all of these different treatments. So even down to the cost of formulas, which many insurances don't cover, the cost of different medications. So these are things that are really important for us to know about as your medical team, so that we can find alternatives to try to get you the medications and the nutrition that you need. As I mentioned, lots of side effects to be managing, and every patient is a little bit different in what exactly they experience and to what degree. And so the best way to get through this is to really keep dialed in with the nutritionist, and with your physicians so that we can make adjustments in your treatment plan and make referrals as needed to additional support. So for example, all of our patients will meet with an oncology dietitian, but in some cases, if the weight loss is too much or we need additional expertise, we will make referrals to a physician whose expertise is in clinical nutrition as an additional layer of support to help manage the nutrition-related side effects. So another common side effect is dealing with mouth sores and mouth pain, both from the cancer itself, but also from side effects of surgery, healing after surgery, or radiation and chemotherapy. So beyond pain medications, like there's a lidocaine mouthwash, or there's even stronger medications that we will use during the course of treatment. Certain foods can be helpful to soothe mouth pain and address mouth sores. Some patients find that eating cold foods can be very soothing and numbing. Taking in soft or mild foods, kind of bland foods that are easily swallowed and doesn't have hard edges that can irritate the mouth. Avoiding foods that sometimes can irritate things. So acidic things or spicy foods oftentimes can impact, can cause more pain. Crunchy things, as I mentioned. And then alcohol and carbonated beverages, many times patients will tell me that those kind of tend to burn when patients have mouth pain and mouth sores. And so being really mindful of what you're taking in and how your body is reacting to them can be a really important key to making sure that you're able to tolerate, to get the adequate nutrition that you need to get to as you navigate treatment. In addition, particularly if you're getting radiation treatments, our radiation doctors will give patients mouthwashes to use to help, primarily baking soda type mouthwashes to help neutralize things and can be very soothing. Sucking on ice chips, things like drinking through a straw to help avoid areas in your head and neck, in your mouth area that might be sore, or other kind of tips that might be helpful as you're going through cancer treatments. During the course of treatment for head and neck cancer, it's really important to have as good oral hygiene as you can. Of course, it's really challenging if you have mouth sores or throat pain. And so using a soft toothbrush, using the baking soda mouthwashes can be very helpful. Avoiding mouthwashes that have alcohol in them so that they don't burn. And then protecting your teeth as indicated, as directed by your dentist. For example, many of our patients will be prescribed or will be instructed to use a fluoride toothpaste or some sort of fluoride gel to help protect the teeth during the course of treatments. And of course, keeping in touch with your dentist is a really important component of care for during treatment and as well as after your cancer treatment is completed. For patients who are experiencing difficulty swallowing, choosing foods that are soft or different consistency can be really helpful. Many of our patients who are going through radiation treatment have to switch to nutritional, like meal replacement shakes, or smoothies, milkshakes that make it easy to swallow, but also get adequate nutrition. And those are areas in which it's really helpful to have the expertise and guidance from a dietitian or a clinical nutritionist to help us sort out how many calories and to ensure that with these alternative types of food that we're getting all the nutrients that you need. And again, kind of avoiding foods that will cause pain, hard foods or things that are tough to chew. Many of our patients find that pureeing food, so sometimes the meal replacement shakes and things like that aren't the best in terms of taste. So oftentimes pureeing food or adding protein powder to foods can increase calories, but do so in such a way that's manageable to swallow. A lot of my patients will add, instead, if we're used to eating fat-free this and fat-free that, changing to a full-fat Greek yogurt or something that has higher nutritional density can be really helpful as well. In terms of pain with radiation, some patients have found that coating the throat, even with a spoonful of honey, can help protect your throat and help with some of the pain with swallowing. One of the problems that can happen as patients go through head and neck cancer treatment is aspiration, where you kind of cough or regurgitate after you try to swallow. And so if you're noticing those types of symptoms, you can ask to meet with a speech and language pathologist specifically to help give you swallowing, address swallowing problems and exercises to work on. And all of our patients will meet with a speech and language pathologist before they start treatment and during the course of their treatment to ensure that they're engaging their swallowing muscles, so that long-term after treatment's done, as much as possible, patients are able to regain that swallowing function. Dry mouth is another challenging side effect that can occur, particularly as patients go through radiation treatments and actually long-term after treatments. And so things, a lot of times, things that can stimulate saliva can be really helpful. A lot of my patients, even after cancer treatment, have noted that, you know, it's swallowing is difficult when your mouth is dry. And so anything that can stimulate saliva or moisten the food that you're eating can be helpful. So chewing gum, sugar-free gum to protect their teeth. You don't want to chew gum with a lot of sugar, or moisten foods, or choose consistencies of foods that are moist. So a lot of patients will find that eating bread even after they've finished treatment can be particularly challenging. If you can try sucking on, you know, sugar-free candies that are tart to stimulate the saliva, or in the same way, drinking something that might be acidic, as long as it doesn't burn your mouth. And as I mentioned, limiting things that are kind of on the drier end or kind of rougher in consistency can help as well. A lot of my patients also have highlighted to me the importance of making sure that you're drinking enough fluids as you're eating and even in between bites to help with manage the dry mouth and the difficulty swallowing that can come with that. And so here's some other tips: saliva substitutes and lip balm and things like that. Change in taste is another thing that can be a problem. And so finding alternatives. Patients have to do a lot of kind of trial and error to see what can work for them, because the way things taste can definitely change from treatment. I know that, so a lot of management of head and neck cancer really revolves around swallowing and speech and changes in taste. And so a lot of these things are really, you know, kind of tips that you can get from other patients who've gone through cancer treatments. And so again, these are some of the strategies that some patients have found to kind of manage some of the side effects related to head and neck cancer treatment, both during treatment and afterwards. And so I think I'm running a little bit short on time. I wanted to make sure that we had a time for discussion and questions. And so I think with that, I'll kind of pause for a second. And if there are specific questions on nutrition or swallowing or other side effects, either during treatment or afterwards, I'd be happy to address them, or questions in general.
Thank you, Dr. Wong. We do have a question. It's actually about proton therapy. So can you discuss proton therapy and would it be good for vocal cord treatment?
Yeah, that's a good question. Usually, as I mentioned, with radiation treatment, we can do, particularly for the vocal cords, it's a very small area. I know our radiation therapists do a lot of precision treatment. Proton therapy is less commonly used for vocal cord cancer, but there are certainly some centers that will utilize proton therapy. I think there's an institute down in San Diego at Scripps, and also Loma Linda. And so we will refer patients down there to discuss proton therapy as an alternative mode of radiation treatment. Typically, it's used more commonly for cancers like prostate cancer, but can be a very focused way to deliver radiation in the correct situation.
Thank you. If there are any other questions for Dr. Wong, you can feel free to unmute yourself or type it into the chat and I can read it out. Yes, okay. How to heal deep fissures from geographic tongue?
Yeah, that's a tough one. A lot of patients after surgery or chemotherapy and radiation do have kind of areas that are slower to heal because the tissues have been affected by the treatment. A lot of times it's, sometimes we will use modalities like hyperbaric oxygen as a way to help the tissues heal after treatment is completed. And a lot of times fissures may heal to some degree, and then it's a matter of managing it on an ongoing basis. So some of our patients will swish with coconut oil, for example, as a kind of a way to coat and lubricate their tongue. And so, but these are definitely challenges that come about after successful treatment of head and neck cancer.
Great. Next question. I'm 2 years post-radiation therapy and I'm still routinely using liquid to swallow anything that is not itself extremely soft/moist. Is that something that typically lasts a lifetime?
Yeah, that's a great question, Peter. It is one of the challenges of having completed radiation treatment because of the effects on the salivary glands and the saliva formation. I think also the tissues inside the lining of your mouth and throat can also be a little bit more sensitive to things. So for some patients, they do kind of have to maintain those kind of changes in diet and consistency longer term, because the dry mouth is still an issue. So it may be, but I would, if you haven't recently, perhaps checking in with a speech and swallow therapist might be helpful to see if there's alternative things to try in terms of exercises that can help with swallowing function. If you haven't tried things like saliva stimulants, sometimes that can be helpful for patients as well to help stimulate saliva so that the swallowing of things that are a little bit on the drier side can be more manageable.
Thank you. It is 6:31 and we have one more question in the chat. Is that okay? Okay,
yeah.
Thank you. Can cisplatin treatment permanently depress lymphocyte count?
Yeah, so the lymphocytes are part of the immune cells, so the white blood cells, and both active cancer or a history of cancer as well as cancer treatment, be it radiation, chemotherapy like cisplatin, targeted therapies or immune therapies can cause low lymphocyte counts. And so oftentimes we can see the lymphocyte count go down, and many months after treatment, the lymphocyte counts may recover. Now, there are some patients who have long-term low lymphocyte counts, even long after cancer treatment is completed. But fortunately, we have not seen that patients, even who have low, kind of long-term low lymphocyte counts, we have not seen across the board that they're more prone to things like other infections and things like that if their cancer has been successfully treated.
Dr. Wong, there's a follow-up to a previous question. Do you mind taking one last follow-up question?
Sure.
Okay, this is in regards to the deep fissures for the geographic tongue. So the response was, actually my geographic tongue has been off and on for 30 plus years. I've never had HNC, but am a breast cancer survivor. So no radiation to HNN, but only in the chest/clavicle area. Those fissures just keep coming back.
Yeah, so I think that, that's a good question. So most of my experience with kind of fissures in the head and neck area have been in the context of radiation, patients who've gone through radiation treatments. And so I don't honestly know if things like hyperbaric oxygen for things like geographic tongue would be helpful. It might be helpful to seek the expertise in the consultation of a head and neck surgeon or an ear, nose, and throat doctor who might have some better solutions.
Thank you so much, Dr. Wong, for your time and for this presentation. And thank you everyone for joining us today.